Okay, hi everyone. Welcome to the Oregon School-Based Health Center's State Program Office Operational Profile Training. Welcome. So I want to start with a quick sound check. So on your toolbar on the right-hand side, if you can hear me, can you please raise your hand? There's a little hand icon. You can just click it. Okay. Great. Looks like you all can hear me. So just a little housekeeping. I want to let everybody know that we have two documents that are attached to this webinar through your right-hand pane. We have the Operational Profile User's Guide, which I recommend you all download and reference. And then we also have the Standards for Certification version 4, which is the new standards for certification that we are now using. So just to do some introductions, my name is Melanie. I am the program support for the School-Based Health Center program. We also have a few other people in the room. We have Karen Bayan. Do you want to introduce yourself?
Hi, this is Karen Bayan. I'm a public health nurse on the team. Hi, this is Sarah Nipper. I'm the epidemiologist and health economist.
And Rosalind will be here as well. And we also have Loretta Jenkins, one of our data analysts, who is on the phone. And I just also want to remind everyone that we are recording this webinar. We will be posting the webinar recording, the webinar slides, and the webinar slides on our website within the next week or so. So if folks weren't able to participate today, or you have partners that you feel should look at this video, they can look at it later on the website. And I will send an email out to the field once it's on the website, so there's no guessing as to when it's actually available. Okay. Oh, and also, if you have questions at any point on your toolbar on the right-hand side, there is if you open it, there's a little field where you can submit questions to me, and we can read those and then answer them throughout the webinar. We're going to keep everybody on mute, so if you have questions, you do need to type them into the box, and please feel free to ask questions at any point. We have a few breaks for questions, but ask them when they come up, and then we'll go through them during the question breaks. Okay, let's get going. So I just want to go over our agenda quickly. We've got a lot to cover today. So we are going to go over the role of the SBHC site coordinator, why, when, and where of the operational profile. We're going to go over the structure of the profile, also staff, who you should include, and the roles that we require, and go over some in-depth information about how to set up your staffing structure through the operational profile. We are also going to go over the changes we have made this year, and if any of you have logged in, it looks a bit different. So that will be really the heart of the information that we'll be going over today. I'll also give you guys a few helpful hints on navigating the profiles and filling them out. And then we will also review the operational profile audit process, which is what happens after the October 1st deadline to fill out your profiles, and we will obviously talk about that. And then I will give a shameless plug to the Operational Profile User's Guide. So that's what we have for today. Okay, so the SBHC site coordinator role. Since we are talking about the operational profile, the first thing I have listed is that we rely on the School-Based Health Center site coordinators to manage the operational profile. They are the person that we consider responsible for updating the profile. And they are really our point person for all things School-Based Health Centers from our perspective. They are the main contact for our office. So as far as managing the operational profile, the October 1st deadline, they are responsible for having the profile done and completed by that date. And then also, as changes occur throughout the year, they need, especially around staffing, they need to keep the profile up to date. Also, another thing that we rely on them for is to make sure that all of the required school-based health center roles are filled, and we'll go over this a little bit more in the staffing module of the operational profile, but there are several roles that we require you all to fill. So I'll go over that a little bit more. Also, the site coordinators, we require them to attend our coordinators meeting. So in October, we have an in-person annual meeting where a representative from each system needs to attend. And then we also have 2 webinars, one in the winter and one in the spring. And those invitations go out to the site coordinators, and they're generally the person that we are creating those meetings and presentations for. Okay, also communicating with partners. Because we consider the site coordinator as our point person for the site, we also rely on you to communicate information that we relay to you out to your partners, local public health, school-based health center staff, back to us. We kind of consider you the pivot point of information between us and the partners that you work with in your area. Also, the site coordinators are responsible for making sure that the encounter data gets submitted to us for the mid-year and year-end deadlines, and the satisfaction surveys, which are also mid-year and end-of-year submissions. Okay. So, why do we have an operational profile? Well, the first thing is, you all know, it's required for certification. It also demonstrates that the sites are in compliance with the standards, especially the new standards, such as the staffing roles and shifts, the hours of operation for that center, identifying whether or not our required services are provided on-site or by referral for those which there is an option, for submitting key performance measures and the financial information. The operational profile, the data that's submitted, that also enables us to answer questions from legislators or partners regarding things like PCPCH status, like the number of sites that are PCPCH recognized, the number of centers with YACs, and lately we've been doing this one a lot, the number of centers with oral health providers. It's kind of our pivot point to look and see what's happening with the sites on a month-by-month basis, and kind of to be able to pull information to get a scope of what's happening as from the state as a whole. Okay. So, when do you fill out the profiles? So, after initial certification, after you submit the application for approval. So, if you're a new site and you're applying for certification, once you submit the application for approval and it is approved, the public health nurse that you're working with will give you a date that the operational profile needs to be filled out, and they will work with you on that. So after you're certified, annually, we have our October 1st deadline. So it's a yearly renewal process. This is the way that you are able to renew your certification with us, is by filling out this operational profile and letting us know what your site structure is going to be for that year. And it's our way of kind of doing an annual check on your compliance with our certification standards. And as I mentioned before, also, you need to fill it out as changes occur throughout the year. This is especially vital with staffing updates, especially if there is a turnover with anyone who has been designated as someone with a role, or if it impacts the shift that you are using in order to be in compliance with our minimum staffing hours. So it's not just the October 1st deadline, it's really throughout the year. Okay. Oh, and if you have a site visit, you would need to fill it out and have it up to date before your site visit, and you can work with your public health nurse on that, because they check it before they come out. Okay. So, where to get started? I also actually wanted to do a quick question to all of you. So if you have already logged in to the new operational profile through this new link, can you raise your hand? I'm just curious how many people or eager beavers then have already logged in. Anybody? Oh, right. Few people. Nice. Okay, so if you have logged in, you obviously have noticed that we have a new login link. I sent that out to all of you via email, but it is also found on our website on the certification standards page. Please delete any bookmarks you have for the old link. It is useless to you now. You will need to use this link. And also, you might want to note that it does look a little bit different. I'll show you a picture of that in just a second. This is what it looks like. So when you use that link, it'll send you to this little page that popped up in the corner there. You can't really see it, I know it's a little tough, but it's full of a bunch of different icons, and one of them has our School-Based Health Center logo on it. So you will click that icon, and then a login screen with the field for your username and your password will pop up, and that's how you would log in. You can bookmark the little screen that pops up with just the login bars, but whenever you log out of the system, it'll take you back to this page. So it's important to know that you need to choose the icon. Okay, so your login information is issued to you by us for new sites and existing sites that have a medical sponsor transfer, the transfer of medical sponsorship. So basically, we are the keepers of the login information. So just so you know, it doesn't change from year to year, and it has not changed with this new link. The new system still uses your login information that you used last year. And if you lose it, or if you have staff turnover and it doesn't get handed off from person to person, just send us an email and we will help you out and give you that login information. And just a note for just so you know that if you have a system with more than one site, it is the same login for every site within your system. So for larger systems like Virginia Garcia or Multnomah County, they have one login for all of the sites. So hopefully that's not confusing. Okay. So this is going to be a long slide. So I just want to go over a little bit of the structure of the operational profile. We have the first tab that will pop up once you actually open a site is the details tab, and I will show you pictures of all of these, so we can go into more depth. So the details tab has the site information, like the address and the name of the school that is hosting the site, county information, your system contact information, medical sponsor information. It also has an area for you to enter in the EHR system you're using. So it's kind of just an overview of contact information for your site and your sponsors that you're working with. Okay, the operations tab, it has the hours of operations, the populations you serve, some information about SQHC and CCCH status, and Youth Advisory Council information. So the staff tab, so we have the main staff tab shows a list of all of your site staff members. So it's the staff list for the site. And then there are individual staff pages where you would put the contact information in or the specific shift for that one staff member. And then we also have a site level shift hours page that shows all the shifts for all the staff for that site. So there's basically, to simplify it, there are site level staff and shift hours tabs, and then there are staff level shift and staff tabs where you put the individual staff member information in, and then there's an overview for the whole site. Okay, we also have a new tab this year called the Services tab, and it has a list of all the services that must be offered either on-site or by referral, and it's how you identify if your site provides those services on-site or by referral. And I'll go into this a little bit more, but this is set up from our new standards. Okay, we also have a KPN tab. This is, it has a list of all the existing key performance measures that the site has submitted over time. And it also includes the new operational KPM biennium selection. And that will, Loretta will go over this information in a little bit more depth later. And then we also have a financial tab. This is where you submit your annual revenue information. So it also has a list of all of the annual revenue entries that have been submitted throughout the history of the operational profile existence for the site. And those entries are broken down by grants and public funds, fundraising, patient fees, third-party billing, other revenue sources, and we'll go into that in depth. Okay, so we also have accuracy confirmation boxes on several of the tabs, and I can show you what those look like. Oh, there it is. That's what they look like. So I'll go over many times where these are at, but these boxes are our way of knowing that you have updated this information, you know, by checking this little checkbox here and then typing your name in here. The checkbox will populate a date, and then the name is how we know who updated it. So we'll know when the page was most recently updated, and for the audit specifically, those checkboxes and dates and names are the way that we know that you are actually done with that page, and if it's not filled out, then we consider your profile incomplete. And we'll go over that a little bit more. Okay, so just a reminder, for the details, operations, staff, and shift hours, and services pages, that information is current. So when you fill it out, it should be accurate for the way your site is currently set up for the fiscal year, and really at any time, especially for staffing. So the fiscal year, just as a reminder, is July 1st through June 30th. So those tabs, again, the details, operations, staff, shift hours, and services tabs, you fill out for the current fiscal year, your current school year, current and moving forward. And the KPMs and financial data tabs, that information you submit annually, and you submit it for the prior fiscal year. So you're submitting to us your KPM audit and your financial data for the fiscal year that just happened, because we know you can't predict what your KPM and financial information is going to be for the future. So you're submitting it for last fiscal year. And this year, that submission will be for July 1st, 2016 through June 30th, 2017. And there's a lot of text here, but I just want to make a note that brand new school-based health centers that are certified on or after January 1st are not required to submit KPM or financial data for that fiscal year. So if you are certified March 1st, you don't need to submit KPM or financial data. If you are certified October 25th, then we would want that information on your operational profile. And SBHCs who undergo a transfer of medical sponsorship on or after January 1st aren't required to submit KPMs, but they are required to submit financial information for whatever portion they were sponsored by this new medical sponsor for that fiscal year. And just if you're not sure whether or not your site, if your site is new or you had a transfer of medical sponsorship, or you're just not quite sure, just send us an email and we will confirm with you, whether or not you have to submit that. But I'm just going to tell you now that 99% of sites will need to submit both of those KPM and financial data. Okay, so an overview of staffing and who you should include on your operational profile. So you want to include all staff that have clinical on-site shifts at the school-based health center. So that includes staff whose hours aren't used to meet certifications. So it doesn't just have to be, your primary care provider or your support staff. We really want anybody that's on-site working at the clinic to have have a staff record and to have their shifts entered into the profile, even if they aren't being used to meet our requirements. We also want you to enter in staff whose data is not submitted to us. So support staff, community health workers, health educators. We want everybody that works there. And in addition to staff that are physically on-site working in the clinics, we also want you to include staff who don't have weekly on-site clinical shifts, but have other roles associated with the school-based health center. So examples of that would be your health department administrator, your school-based health center administrator, people that work off-site but have a role with the clinic. Or another great example that actually comes up semi-often are oral health providers or other providers that aren't there on a weekly basis. If they're not there at the same time every week, don't enter that shift, but we still want them to be listed as staff members on your profile. And I'll go over how you do that. So you would use the comments box for folks that don't have shifts, but you have them listed as a staff member. We want you to enter in a comment, and I'll show you exactly where to do that, and I'll go over this again. But we want you to enter into the comments box on the shift hours tab of their individual record. We want you to let us know what their role is, where they actually work, and the typical weekly shift schedule, or if they're an oral health provider that comes in once a month, you would just write that as a description in that comment box. So an example for a health department administrator, you would just put, health department administrator, they work Monday to Friday, 8 to 5 at the county health department. And that would give us an understanding of why they don't have shifts listed. If you have a staff member that you don't have shifts listed and you don't have anything in the comment box, it makes us wonder if you haven't finished filling it out, or what the deal is with that staff member. So just, it doesn't have to be super detailed, but just write something in the comment box so that we know who that staff member is and why you have them listed for the site. Okay, so staff roles. I mentioned earlier that we have some required roles that you all have to assign for your sites. And so this is a list, and we have role descriptions for these in our certification standards, which I have attached to the webinar. They're in the back. It's like it's a grid, so you can kind of look at how an explanation of what we mean by these role titles. So, and I'll show you where you indicate these roles. But this is the list of all of the required roles that you have to fill out. And just to note, it's entirely possible for one staff member to hold multiple roles. That's actually relatively common, especially in some of our more rural sites where the same person is the site coordinator, the site administrator, and the privacy official or something like that. There's some people that are wearing a lot of hats, but just so you know, you don't have to have one person for each one. People can double up. Okay. So, and there are more roles than this that we have listed on our staff tab for you to choose from. And so They should be assigned appropriately to reflect the staffing model. So for instance, we don't require a QMHP role, but a lot of people have mental health providers, and so you would assign that role to them, or oral health providers. Oh, and I mentioned this earlier, we have our role descriptions and the certification standards of our website, which is that. Okay, that was a lot of information. Does anybody have any questions before we move on to the changes that we've made to the profile this year? No questions? Okay. All right, well, if you think of something, just write it into the box. Okay. So this slide may not mean a whole lot to you, but I'm just trying to give an overall summary of what we've done with the profile and what's new and what hasn't changed. So just as an overview, oh, we do have one question. Okay, so we had a question about whether or not you all are able to delete staff members, or if I still do that for you. So the system for deleting staff members is still the same as before. So you all will actually delete the shift for the staff member. You will delete the sites that they are associated with so that they don't show up on your school-based health center staff list. So they would only show up on your system staff list at that point, and then you would email us their name, full name, and then we would delete them from your system staff list. Don't delete like their name and their address and all of their roles. It's really unnecessary, and you don't need to spend time doing that. All you need to do is delete their shifts and delete the sites that they're associated with, and then send us the their name so that we can take care of that for you. It goes pretty quickly, and also there's detailed instructions on how to do that in the user's guide. Okay, and then we also had a question. Once you have signed off on a section, can you go back and edit it at a later time? Steve, absolutely yes. You guys can keep updating these sections as much as you want to. So I would just recheck the box that populates the date that you have updated, the confirmation box. Just click the box again to let us know that something's been updated. Absolutely, you can update all, the only tabs you really can't mess with are the KPM and financial entries. And I'll go over a little bit more. There's, those are really just submitted annually. So once you submit them, through the audit process, you'll be able to make changes to them when you work with us. But really, after that point, they shouldn't really require changes. But all of the other tabs, the details, the operations, the staff, shift hours, and the services tabs, those can be updated throughout the year. It's not a one-time thing. Okay. So, oh, I have to go back. Sneak peek there. Okay, so I just wanted to give you an overview. We have added one tab that I mentioned before, the services tab. We have made changes to the operations tab. And when I say make changes, I mean that we have either added a feature or added something you needed to fill out. So functionally, there are changes. So the operations tab, the individual staff and shift hours tabs, those have changes. The waiver tab has a small change, and the annual revenue detail entry is a bit different this year. And then we haven't made changes, so functional changes to the details, main staff tab, the main shift hours tab. And when I say main, I mean the list for the whole site, not the individual. And then, oh, I listed waiver twice. We actually have made a change on the waiver, so you can disregard waiver from the not made changes column. And then the KPM and the financial main tab, where the list of all of the financial entries has not been changed. And then for those of you who have actually already logged in, you'll see that we have, the whole site has a new look. It actually has color. And some of the boxes are rounded, but functionally, it is it is very consistent with the old system. So I don't expect you all to have too many challenges navigating the site with the new look. Okay, so we had a question of what is the difference between the annual revenue detail and the financial tab, and I will explain that. So we have, I don't know, it's 6 or 7 tabs that are listed across the top of the profile. And here, I'm just going to click to the next slide to show you this. So oh, did it go? It's changed on my screen, but it's not changed on your screen. So let's give it a second here. It'll come through, I promise. So basically, the financial tab is where there is a list of all of the financial entries you have entered through the history of the operational profiles. So it's all of the annual entries. And then on that tab is where you select specific entries, and the annual revenue detail is the overview of those specific annual entries. So there's an annual revenue detail for each fiscal year that you submitted entry for. Hopefully that's not too confusing, but it'll make more sense once we actually get to that slide. So we are now looking at the new site. So this is the details tab. We haven't made any structural changes to this tab, but I'll go over the layout a little bit with you. So at the top here, we have the school-based health center name and the host school name. And then this SBHC info area is where you would fill out your physical address. And if your mailing address is different, you would fill it out over on this side. And I just want to note, if you have a different mailing address than your physical address, you need to click this little box over here to let us know. Most of you do a fantastic job with this. And then there's a little area here where you tell us which EMR system and some billing information. And then we also have county information here and your system and medical sponsor information. And if you edit those, you would just click on these edit county info and edit system info boxes in order to drill into those areas. And I just want to note, when you're filling out your address information, we export this information, and this is how we determine which addresses to mail our materials to, like our status reports and updates and the certification standards, or certification letters or anything like that. So it's really important that when you fill out this area, you are using proper punctuation and really making it accurate for where you want your mail to actually go. We have, there's consistent issues with mail going to addresses that are on here and getting returned because the address isn't accurate. So I know it seems arbitrary, but try to keep that up to date because we use this information regularly. Okay, so I also want to point out this is a tab that has one of those fabulous accuracy confirmation areas. So this little box down here in the right-hand corner will need to be filled out with a date before the October 1st deadline in order for us to consider this tab up to date. If you haven't filled out that area, then we assume you are still making changes and it's not final. Okay, moving on. So our operations tab, this is where you fill out your hours of operation for clinical services. This includes your physical, behavioral, and oral health services. So anytime the clinic is open, these are the hours that need to be reflected here. And then we also have an area over here for you to list your summer hours. Some people who are open during the summer aren't open during the same hours. So we've separated that out for you to list those. And there's a little yes, no button for whether or not you're open during the summer. Then we also have an area over here on the left for population served. It's where you tell us who in your community you serve, if anybody beyond the students at school that the school-based health center is on. And then we also have areas for whether or not your site is a federally qualified health center site. And I'm going to skip over PCPCH because I'll talk about it in a second. And then we also have just a checkbox on whether or not you have a youth advisory council. And so if you check that, that means yes. So one little note about the hours you list here, please don't use military time. Our system is not as sophisticated as Epic. It doesn't convert military time to standard time, so you need to just type it in as it looks. So don't forget your AM and PMs as well. And then as far as the PCPCH area, we have updated the tier system. So PCPCH folks have changed their tier system, and we have updated this drop-down menu to reflect that. So you'll need to make sure that that is updated. And also, if your site is no longer recognized, PCPCH recognized, or your tier level has changed, please, please, please update this information. We export this all the time for questions from legislators and partners. So we do rely on this information to be accurate. And also, please make sure that that state of lack of recognition is accurate. Okay, and then I also want to point out that this is also another tab that has the handy dandy accuracy confirmation box that you will need to fill out in order for us to consider this tab complete. This is especially important for the October 1st deadline. Okay, so moving on to the staff tab. So this is what I was talking about. This is the staff tab that shows all of the staff members that you have listed as working for this school-based health center. So if you want to edit existing staff members, what you would do is click on their respective little orange To Staff button over here, just like the old system. And to create new staff members, or to add a staff member that works at another site in your system, you would click this little staff list button over here in the upper right-hand corner. And also, this tab also has an accuracy confirmation box that you would need to fill out. And so just by clicking in this little checkbox and putting your name in here, you are verifying to us that all of the names that are listed here, that this is your staff roster as of current, and it's accurate. So you're verifying that all of the information and all of your staff records is accurate as a whole. So it's important. Let's see here. Okay, and then, so this is what, if you click that To Staff button to open up an individual staff record, this is what will pop up. They have two tabs, the staff tab and the shift hours tab. So we're going to go over the staff tab of the individual staff record first. So this is where you enter in the staff name and their contact information. And if they would receive mail at an address other than the school-based health center, you would want to enter in that information here. And this is especially important for site coordinators and for the administrators. We do send publications and mail to you specifically, so please make sure that that information is accurate, and make sure you list the name of the organization so we know the entity we're mailing it to. Otherwise, it would just go to you at that address, and sometimes your mail centers at your organizations would bounce that information back. So, okay. So we also have over here, we have a list of roles. A lot of these are the required roles that we talked about earlier. Some of them are not required, but these are what we consider the role list here. And we updated them to reflect the name. We did a few name tweaks of the roles. So oral health provider instead of dental health provider. So if you already had them checked before on existing staff, you don't need to recheck them. They should still be checked, but some of the names have been updated to reflect our new standards. I also want to point out, if there is a role or a credential that is appropriate for your staff member and it's not listed on one of our checkboxes, that we have created these boxes at the bottom for other roles and other credentials. This is where you would just type in the name of the role or credential. Like if they had a different, I think there's a different expanded function dental credential that is slightly different than this one, just type it into the other credentials box. It's really helpful for us when we're looking at the sites as a whole and seeing how many of our sites have this particular type of dental provider. So just fill out the other box, the other credentials or other roles boxes if those are different. Don't just choose one that's kind of similar but not the same. Just type it in. Okay, and then I also want to point out this SBHC is associated with that staff member area. So this is where you list the school-based health center that the staff member is associated with. They either have shifts or they have a role at that site. This is super important because this is how you get this staff member to show up on the site's staff list. So if you don't add the SBHC here, they're not going to show up on that main staff list for the site. You also have to add a school-based health center in here in order to add a shift on the next tab. So you really need to do this before you try to add their shifts because it kind of freezes the system a little bit if you don't. So just a reminder on that. Oh, actually, I want to go back and tell you, there's also this down here. This is where it lists the systems that your staff member is associated with. You guys can't update this, we do. So don't worry about it too much. Okay, so on to the main shift hours tab. So this is the tab for the site where it lists all of the shifts that all of your staff members have for the site. So this is the whole site shift list. So everybody that works at the site, their shifts would show up here. We haven't made any changes to this tab structurally. If you have a shift on here and you need to go in and change it, you just click one of these orange to staff buttons, and just like the main staff tab, if you need to add or create a shift, you would click this button up here. And then we also have an accuracy confirmation box on this tab down here in the right-hand corner. This is how you identify to us that all of the shifts for this site are all accurate and up to date. This is another one of those confirmation areas that has to be filled out in order for us to consider this part of the profile complete. You have to fill it out for the October 1st deadline. Okay. So adding shifts for individual staff members. So when you go into an individual staff record, they have that staff tab that we already went over where you select the roles, and then they have this second tab for the shift hours. Let's see here. So this is where you would add the shifts for each staff, for the individual staff member for all of the sites that they work at. And this little warning message up here that says shift hours entry is missing information. So if you haven't filled out the shift completely, like this shift that is showing here on the second line, it obviously has more information that needs to be filled out. The day of the week that the shift is on, the start time of the shift, the end time of the shift, and the site that the school-based health center is, the site that the person is working at. So all that information would have to be filled out. And until it is, this little warning will show up. And if you try to leave without finishing a shift, this little warning box will pop up that says shift incomplete. So you just hit the OK button and finish filling out the shift, and then you'll be able to actually navigate away from the staff page. So this is why it's really important to make sure that the staff member has the school-based health center listed on the previous main tabs, because you can't leave the shift tab until you tell us what site their shift is at. So if you didn't list the school-based health center and this keeps popping up, you may have to completely close out of the profile in order to kind of get it to reset. So that's why it's super important to list those sites. Okay, so we actually have a couple questions. I'm going to go ahead and answer them while we are here. So it says, we have to SBHC, let me see here. Does this make a difference when filling out shift hours? I'm assuming that we're supposed to say we have multiple SBHCs. Does this make a difference in filling out shift hours? What you would do is over here on the right-hand side here where it says SBHC name, there's a little drop-down menu. And so if your staff member works at multiple SBHCs, you would just list their shifts for each SBHC. And so one line would be their shift at that SBHC. So if they, let's say they work at, I don't know, Columbia River SBHC. And so you would just click this little drop down arrow here and select that SBHC. So there's only one staff record for a staff member per system. You don't have a staff record for each individual site. You would list all of their shifts for all of the sites that they work at on this particular page. And then what do you do if there is no delete button to use? So you are able to delete the shifts. Over here on the right-hand side, there's these little black round buttons with an X in it. That is how you delete the shifts. So you are fully able, the way we have the profile set up, to delete the individual shifts. The only thing that you can't do is remove a staff member's record from your system staff list. That's the only thing that you need our help with. And we had another question. Is it still important that we note shift ends at noon and starts again at 12:30 to show they are off for lunch? So, no. I think what you can do is just show their morning start time and their evening start time. It's a lot of work to go in there and split it out, and our sites don't do that consistently. So that was a good question, Ellen. Don't worry about doing that. Just have it cover lunch. So one shift per day. Okay. And Lynn, let's talk offline about the delete button on your screen. It might have something to do with your web browser, and we can address that. Okay. Well, you guys are being really great about questions here. Let me get through these here. So if a shift hour is split between multiple sites, but not on a set schedule, what would be the best way to represent that in the shift hour? So, John, are you, and feel free to write back in the comments box, what we want listed here are regular weekly shifts. And if they have a morning shift at one site, you would list that morning shift. And then if they had that same day an afternoon shift at another site, you would have two lines. One for the morning shift at one site and one for the afternoon shift at the other site. If it's not a weekly regular shift, let's say they only come in once a month, then you would not enter a shift because it doesn't count toward our required hours if they aren't there on a weekly basis. They need to be there on a weekly basis. Then you would fill out, like I mentioned before, you would write in this comments box that I'll highlight in a minute down here in the left corner. You would write in the comments box how often they have a shift kind of explain why it's not listed. And this is also, you know, there's a little bit of gray area with this. So when in doubt, contact our office and we will talk about your specific situation individually. So hopefully that answered your question. Okay. And Lynn, I see your follow-up comment, so we're just going to have to talk offline, and I can go over I can walk through your profile with you. Okay, let me see if there's any other questions that I have not answered. Okay. Okay, it looks like I've gotten through all of your questions for this moment. So I'm going to keep going on. Okay, so I talked about the comments box. So with the comments box, all staff with an SBHC role should have their shifts listed on this page, and if they don't have a weekly on-site clinical shift, like the health department administrator or a, like I mentioned before, an oral health provider that only comes once a month, this is the comment box that I've been talking about, where you would list where they physically work and their typical shift hour increment, whether it's weekly, you know, bi-monthly, and the day and hours that they work those shifts in this comment box. So an example is, you know, like I mentioned before, the staff, the health department administrator. So this staff member is health department administrator and health department school-based health center primary contact. They don't have an on-site shift. They work Monday through Friday, 8 to 5 at the county health department. This is a very thorough, great example of why someone doesn't have a shift. And when in doubt, contact our office and we can totally help you with this. Okay. Okay, so this is a new tab that we added. Yay, pretty exciting. So it contains a list of all the services that must be offered either on-site or by referral. And this is in reference to the section E, which is the comprehensive pediatric healthcare services of our new standards. Table 2, it lists all of the services that we require sites to provide. And some of them, you have the option to provide them by referral or on-site. And so these are those services. So what we want you to do on this tab is to click either the on-site or the by referral box for each of these services listed here in order to indicate to us how you handle that service in your at your center. So we need you to choose one or the other for every line with those radio buttons that I was just hovering over with my cursor. And then just like the details, operations, staff, and shift hours tabs, this tab also has an accuracy confirmation box, which is where you tell us that this is accurate and up to date. And this is something that also needs to be filled out by the October 1st deadline in order for us to know that you have finished this tab. Okay, one more tab and then we'll have another questions break before we get into the key TMs. So, let's see here. We have one question. What if we do both, on-site and sometimes refer, depending on the circumstances? Can you check both boxes? No, you can't check both boxes. So I think you need to tell us what you most often do. No?
If you have the service available, this is Rosalind, if you have the service available on-site, then we would want to know that that service is available on-site. And maybe this is a good clarifying piece to put, I don't know, in the manual maybe or here, but we would want to know if you are doing referral because you do not provide it on-site. So if you do it on-site, we want to know on-site.
Okay. Hopefully everybody got that.
Because that means the service would be available to somebody.
So you see, this is specialty services, right? So these are the services on the comprehensive on, let me go back. In the certification standards that we say that you can do by referral, so those are the services that we have listed there, and we want to know whether or not you actually provide them on site or you choose to do them by referral. Okay. So waivers. See here. So the waivers tab is not something that needs to be filled out for the annual October deadline. This tab is used if a site has changes that will bring them out of compliance with our current standards for certification. Then the site would submit a waiver explaining the issue and presenting a plan to come back into compliance. So this site is really used if you're going to be out of compliance for more than, 20 days? If you're going to be out of compliance for more than 20 days, then you would need to submit a waiver to our office through the operational profile, and this is where you would do that. You know, you would click this little add waiver button, and then this box here where you fill out your waiver would pop up, and this one's already filled out. So there's an area for the person submitting the waiver to enter in their contact information. There's an area to tell us who your county contact is and whether or not they've been notified. There's also, below that, there's a certification section area where you indicate what section of our certification standards you are going to fall out of compliance under. And then there's boxes down here for you to tell us specifically within that section which standard is not being met. And then below that is where you tell us why it's not being met at the moment. And then below that, you tell us what your action plan is to meet that standard, how you plan to come back into compliance, and specificity is appreciated. Then down here at the bottom on the left, there's an expected date of compliance area where you tell us the date that you believe you will be back in compliance with our standards. Okay. And then when you're all done with that, you click this waiver information complete, submit to state program office button. This triggers an email that will be sent to our office. And we added a handy dandy little confirmation box. So when you hit that button, this little box will pop up and it'll tell you that the waiver has been sent to our office. This is so you know that it actually worked. If you get anything other than this, if you get an error message, then you have our permission to hit that submission button again. But hopefully this will be useful so that you guys know that you clicked it and it actually triggered something. I know that had been a question in the past of people not knowing whether or not it actually made it to us. Okay. So we're going to take a questions break, and then Loretta will present the KPM tab. So does anybody have any questions while I am unmuting Loretta? Doesn't look like we have any questions. Loretta, are you?
I'm here.
I've unmuted you. Are you there?
Yes, I am.
Yes, I am. Okay. Take it away.
All right, so here on the KPM tab, you'll see that we don't have any changes that we've actually made to the operational profile, which is great news, hopefully, for everybody. I just want to look at this briefly and talk about what's on the KPM tab before I go into a little bit more detail about your KPM entry and all of the things that go in towards that, towards you being able to make a complete submission. So here we've got a list of all of the KPM audit results that have been submitted for your school-based health center. It also, down at the bottom, shows the optional KPM biennial selection. And like the name says, that only happens, it's only updated once every 2 years. And if you are viewing a KPM entry, the box on the right of the screen will pop up if you press the select button. So when you first go to that KPM tab, you aren't going to see the big box that's on the right of the screen. And just as Melanie said, this is a reminder that KPM information is should be submitted for the previous fiscal year. Like Melanie also said, you can't foresee the future and know how many charts you're going to have in compliance. So let's go on to the next page. Next slide. And so this is a reminder. This is, I want you guys to remember that on our website, we've got all of this information about the KPMs. We've got guidance documents that are really important for you to review as a reminder of a description of the key performance measure, who is in the eligible population, if there are exclusions, the specifications of the measure. There are FAQs on each guidance doc, and there are also resources. And as a reminder, we've got new KPM guidance documents that will be effective, that were effective for visits that occurred July 1st, 2017. So when you guys get ready to go and do your chart audits that are going to be due on October 1st, they're for the previous fiscal year. So you need to make sure you're looking at the guidance documents that are for the previous year. And Melanie's done a great job on our website of identifying which are for which. So, and if you have any questions, just don't hesitate to touch base, send me an email, call me, that's fine too. All of the codes that you need to refer to for the particular measure are listed in that guidance document. So feel free to look at those closely. And if you have any questions, just give me a call. On to the next slide. So the number of charts that you need to audit, we expect sites to audit 20% of the charts from the eligible population. Now this goes back to why it's important for you to look at the guidance documents, because in there it identifies who that measure is targeted for. So age range, if they have certain criteria, like for the chlamydia optional measure, they have to be sexually active. So 20% of the charts should be audited from the eligible population, minimum of 30 charts. So let's say your 20% is only 19 charts. Well, you're going to audit all 19 of those charts. So we'll understand if your 20% doesn't match up with that 30 charts. The most number of charts that we require you to audit are 50. There are some sites that audit all of their charts from the eligible population, and that is perfectly fine. Just make sure you do a minimum of 30 and a maximum of 50, unless, like I said, if you don't have 30 charts that are in that eligible population. Contact me if you want me to look at your data and try to help you make sure you are selecting the right number of charts. I can help you with that since I have all of your encounter data. The same charts can be audited for each measure as long as that eligible population is the same for the measures. Where it becomes tricky, and I'm going to give you an example. So for people that are doing depression screening as their optional measure, the age range is different for those clients. They don't do that. They don't do a chart audit on that measure for kids that are under the age of 12. So again, go back and look at the guidance document, look at the eligible population and the criteria for that. If you have chosen nutrition screening as your optional measure, it has the same eligible population as the health assessment and the comprehensive physical. So if you've chosen nutrition screening, honestly, it's the easiest for you doing your chart audit. You can audit all of the same kids for all three of those measures. Again, just touch base with me if you have questions, if you need clarification, because I'd prefer you not spend time auditing charts that you don't need to audit and wasting your time. I always feel bad when I hear that folks have done that. So I would prefer you err on the side of getting in touch with me if you've got questions. We can go on to the next slide. So there are required documents that you have to submit to our office. And those need to be submitted to me before you go in to do your KPM entry in the operational profile. Those two documents include a chart audit process summary, which, as you can see here, it's an explanation of how you identified the charts eligible for the audit, how the data was obtained, and how you calculated it for each measure. If you want to touch base with me again about that, feel free to do so. I've got quite a few sites that send in to me their chart audit process first before they go and actually do their audit to make sure they're on track. Again, don't ever hesitate to touch base with me because it can save you time. The other document that you have to submit for your KPM entry is the audit tracking sheet. This needs to be a spreadsheet of some sort. And on the next slide, when we get there, you'll see a sample of the information that I need you to collect and document in this audit tracking sheet. But you need to submit into our office what patient charts were audited, the results, whether or not the chart was in compliance for each measure, if it was excluded, why it was excluded. And we do have a sample spreadsheet listed on our website also. It's an Excel document. You can also create a Word document, whatever is easier for you all. We just need to have all of the information collected. So we can go on to the next slide. And on the next slide, here's a screenshot of if you used our Excel document, the sample we've got on the website, what kind of information you'll be submitting. So for each school-based health center, we need its own audit tracking sheet. Otherwise, we're not going to know which this applies to. And it just makes it easier for me to keep track of everybody's if you create separate documents. So if you've got 10 sites, yes, I do need you to have 10 tracking sheets separated out. So you'll see here patient ID. You can either send in the actual medical record number for the patient, or you can come up with like a dummy patient ID number, whichever you want to do. If you do submit in your tracking sheet the actual medical record number, you will need to have me initiate a secure email. So when you send in that document, we don't have patients' record numbers floating around in the universe. So, but you also are perfectly fine with, like I've done here, just creating a dummy ID code. And then you're going to have each one of your measures listed in a column. So for the well visit, the health assessment, and then your optional measure. And in each one of those boxes, I need you to write whether or not the chart was compliant, if a patient refused, if the chart was excluded, and over in the comments box is where I need folks to make a note if the chart was excluded, why it was excluded. And I'll give you an example of why they were excluded. If the patient refused, if the parent refused, that's a time that you would put in the comments box. That way we understand what happened with that when you were performing that audit. And if you look down on the fourth row, there's a box that's in the optional measure that says not reviewed. And that would indicate that the client was not in the eligible population. So let's say it was a 6-year-old client. They were in compliance for the well visit, in compliance for the health assessment, but your optional measure, like I had mentioned before, was depression screening. It's not appropriate for you to review that chart for that young child. And so that's why it would say not reviewed. And all of that information saves us time on our end, not having to go back and ask you guys questions, and it just gives us a better picture of what's happening with your audit. You need to submit this document, the audit results tracking sheet, and your process in order to, in my eyes, to be able to go on into the operational profile and then do your entry. So let's go on to the next slide. And just as a reminder, so if the chart audit tracking sheet has a medical record number, submit it securely to me. Some sites have the ability to initiate a secure email on their end, and that's fine. You can do that. If not, send me an email and I can do that. For sites that have chosen the optional adolescent immunization measure, instead of doing an audit tracking sheet, because the auditing actually happens at the state level with the immunization program, what we'll need you to do is send to me a spreadsheet that has the patient's name, their date of birth, gender, race, their address. And this is for all clients that were 13 years old and were seen in your school-based health center. So this will be for last year. And if you have specific questions about how to find kids that were this age in your database, just contact me. I'm more than willing to help you figure that out. And like I said, in order for you to do a KPM entry, if you have the optional adolescent immunization measure, you have to submit that document to me before you can go in and do your KPM entry. And let's go on to the last slide that I'm talking about for the KPMs. And so this is just that same first slide. So when you go onto the KPM tab and the operational profile, I've got an arrow pointing to the Add KPM button. You'll press that when you're getting ready to create a new entry, and the box will pop up on the right. I've gone ahead and entered in this information, but obviously it'll show up. All of that will be blank. And what's really important is I need you guys to make sure you correctly select that fiscal year. If you don't select the fiscal year, that entry isn't complete, and that means that is not in compliance. You have to be sure you select that fiscal year. And then, as you can see in the next box, you're going to put in the number of charts you reviewed, the number of charts that were in compliance. A percentage will pop up under those boxes when you've done that to tell you the percent of charts that are in compliance. If that percentage is higher than 100%, then you've made a math error. You've entered things into the wrong boxes. So make sure you put the number reviewed and then the number that are in compliance. You'll do that for the health assessment. And then when you get down to the optional measure, now the screenshot here shows the adolescent immunization one, and they don't have to, folks that chose that measure, don't enter anything into those boxes. That's our responsibility. But it'll pop up for those of you that do have to do those entries. It'll pop up and tell you what your optional measure is. Go ahead and put reviewed, number reviewed, and number in compliance. And then really important, the next thing, the required documents. And I've got arrows pointing to those two check boxes. You can't press those check boxes if you haven't sent me your documents. So please be sure you've submitted those to me via secure email if necessary before you go in and do your KPM entry here in the operational profile. Go ahead and put comments down in the any explanation that you need to on the entry, and then hit that button, the KPM information complete, submit to SPO. I can't emphasize enough how important it is that you guys submit that those other documents in, because I'll be on the phone with you if you haven't done so. And that's it for the KPM slides. If folks have questions.
Hi, everybody. So if you have questions, enter them into the box, and then we will get back to you at the end of the webinar. I'll send you an offline email. We only have a few minutes left, so I want to get through some really important information before the time is up here. So, okay, so I just want to go over the financial tab. This is that main financial tab that I was talking about that lists all of the entries that you've done over the years. In order to open them, you would hit this little select box, and then this pane up on the right side would pop up showing you your summaries. And to get into that, you would hit this view entry button. If you want to add a new entry, you would click this add annual revenue button, and then that would drill into this annual revenue detail tab, what I was mentioning before. So it goes over, let's see here. So at the top of the detail, there's an area to enter in the contact information for the person who fills out the profile. And then there's also an area to select the fiscal year. I also want to emphasize that, again, when you enter in your revenue entries this year, you're going to be entering them for the previous fiscal year, and you would just use the drop-down menu to do that. And then, so it's split into 3 separate tabs. You can see that we're on the public funds, grants, and donations tab, and then I'll go through the other 2 tabs. And the information here is the same as last year. It's relatively self-explanatory. I also want to let you know that if you enter in a grant or an in-kind donation and your total doesn't show up at the bottom there, it'll calculate. Don't worry, just close out of the entry and enter back into it. Okay, so this is the fee and billing tab. So this is where your patient fees and your third-party billing information is entered. On the left-hand side, the patient fees is all the same. On the right-hand side, this has been changed this year. So for third-party billing, we have split the entries into mental health and to all other building revenue, as you can see. So if your site receives any revenue from mental health billing, you would check the yes or no button here. If they don't, then this area down here that's in orange below it, you would just not enter information into that area.
And this is Sarah. I just want to clarify. I know a lot of folks, you know, your mental health provider is a different agency. This may require working with that entity to get that information. Most sites that I'm aware of, that third-party billing for mental health does get put towards the school-based health center. But I know there are a few of you for whom your mental health provider does bills, and none of that money comes back to the SBHC at all. So if that's the case, then you would not be filling out that section. But most folks, if you have mental health services in your billing, then you would need to be filling it out separately.
So Sarah, this is Rosalind, just to clarify, it is not whether your mental health provider bills or not, it's whether the reimbursement comes back to the center.
It's whether the reimbursement comes back to the center. If you have questions about that, because it does get a little tricky, please email our program email or email me.
Okay. So, and then this area on the right-hand side is where you would enter in all other billing revenue, which would be for physical or dental billing revenue. And then just to point out that billing revenue should be adjusted charges, which is total charges minus any adjustments. If you can't do this, then just enter in the payment.
Again, Sarah, if you have questions about that, because that's a little different, please email me and we can talk about what makes most sense for you. Okay.
So, and then this is the third tab of the annual revenue detail, and it has the others in total area. So any other funding sources that you have that aren't covered in the other tabs, this is where you would enter that information. And then over here on the right side is where all of those totals from the numbers you already entered would show up and calculate. We also have a feedback box down here. This is where you can kind of enter in tricky situations or any information you want us to know so that it would better help us understand your entry. And then when you're all done, when you're finished with the entry, you would click this financial information complete button here in the corner. And when you do that, it will populate a date back on that main financial tab here. You can kind of see I've highlighted a little date submitted. That's your way of confirming that this is done. So we need that date in order for us to consider this done when we do the audit. Okay. So keep typing in those questions and we will email you back specifically. Okay, I'm going to breeze through this because we're pretty much done over time here. So don't use the back button in your browser, use the navigation we have in the profile. All your changes will be automatically saved. There's no save button, so just type it and it'll be there. Make sure you check all those accuracy confirmation boxes. Again, this is what they look like. And they're located as a reminder on the details, operations, staff, shift hours, and services tabs that we already went over. It's really important that all of the information is accurate. And this is important. So you need to make sure that when you're using the profile, you use Chrome, Safari, Edge, or Internet Explorer 11 or higher for your internet browser. The Firefox and older versions of Internet Explorer don't really work very well with this new system, so try to do that. And then, like Loretta mentioned, make sure all your KPM percentages are under 100% or at 100%. If it's over, it's wrong. Those are some common mistakes that we see. So, and we're going to breeze through this again. Let's see here. So the audit process. So the audit process starts after the October 1st deadline. And what we look for is that you've basically completed all of the tabs that I've mentioned with those confirmation buttons and the KPM and financial information. So we want to see that you've actually filled the whole thing out. We want to see that you're meeting our minimum operating hours and our minimum staffing requirements and our minimum KPM requirements. If you aren't meeting any of those things, or if you haven't filled it out, we will be contacting you. And I just want to emphasize that we are here to help. So this is not meant to be a stressful process. It's not meant to be really rigid. So please reach out to us. We really want to help you succeed in this process. And also a shameless plug to our operational profile users guide. This has step-by-step instructions, and it can be found on our website on the certification standards page, and it's also attached to this webinar. Okay, that was a lot of information. We have come to the end. If you guys have questions, keep typing them into the comments box, and I will get back to you individually. I just want to thank everybody. I'm sorry we went over a little bit on time.
Or email the questions, because once you close, they can't.
We'll get them. Yeah, if it closes and you can't enter your questions, just send us an email to this state program, sbhc.program email address, and we will get back to you. Thank you, everybody, for participating, and we will be putting this on our website, and I will send an email out to you once that is up and running. All right. Thanks, everybody.